Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about protecting your brain and protecting your brain in the long run. Cognitive decline is a huge factor in aging, and so Alzheimer's, cognitive decline, Lewy body dementia, there's a bunch of different things, but dementia and loss of cognitive function is one of the bigger challenges we have. It is almost entirely preventable. We don't generally hear that, but while it's not treatable, and I'm not entirely sure it ever will be, the information we have gathered has clearly showed that there are a long list of risk factors that contribute. This was a particular study looking at dietary nitrates, we'll talk about that in a second, on 1,254 Australians, and they followed them for up to 10 years, and they found that people who had a higher dietary nitrate intake had better cognitive function. There's a couple important things to remember here, though, is that just because we eat our green leafies that are high in nitrates does not mean that they're going to convert to nitric oxide. Nitric oxide is a really protective compound for our blood vessels. You protect the blood vessels, you protect the brain. It's also good for the immune system. Things like sunlight exposure, exercise, dietary nitrates help us form nitric oxide. Two factors that has to happen is, first of all, when we talk about dietary nitrates in food, they have to get converted to nitrites by bacteria in our mouth. So if you're using an oral antibiotic rinse, you are probably not getting the same benefits from your green leafies. We know that antibiotic mouthwash actually increases blood pressure. So that's probably because you're killing off these nitrate-fixing bacteria. Secondly, when the nitrites then hit stomach acid, they can convert it to nitric oxide. So if you're overly stressed, if you're getting older, if you're on omeprazole, Nexium, Prilosec, any of those drugs that stop stomach acid, you are not going to get the full benefits from your green leafies, on top of a long list of other problems you're going to have. Or don't forget, if you had gastric sleeve surgery or gastric bypass, you've removed the portion that makes stomach acid. So yet another way to protect your blood vessels and brain with no downside. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs information, and subscribe to the channel.